That was a warm up. Hello, everybody. This is Dr. Elsie Coe. I'm CEO and founder of Lead Physician. I am here and so happy and grateful to have Stephen Wolt, who is the CEO and co-founder of Veritas Solution. And we're going second time around because we didn't go live the first time. I apologize to Stephen, but he's an incredible person. He has an incredible solution for healthcare professionals that really opens my eyes. I want to share this with all of you because this is something that we need right now. We are in a crisis. We see healthcare professionals on camera, on TV, on social media, hurting, really burnt out, dealing with COVID patients and the overflow in our hospitals. I'm so happy to announce and show what Veritas Solution can offer your physicians, your healthcare professionals. Thank you so much for being here, Stephen.
It's great to be here. Good morning.
Good morning. Can you tell us briefly how you started Veritas Solution and how this is different from any other coaching program that might be out there for physicians, healthcare professionals, and giving them discrete, confidential, clinically based, evidence-based medicine to them in a virtual platform?
So first, Veritas is a virtual outpatient substance abuse treatment program that is specifically designed for physicians, nurses, dentists, and pharmacists, those individuals that hold a medical license. And we offer clinical treatment on a virtual basis, as well as physician and nurse coaching. My two other partners in this are Freedom Institute, which is a large New York City-based nonprofit. Actually, they've been founded in 1976. They've been in the outpatient substance abuse treatment business for almost 50 years. And because they're located in Midtown Manhattan, in walking distance to some of the biggest hospitals in the world, they've been working with healthcare professionals for quite a bit of time. So they have a really unique skill set in working with this demographic of patient. Our other partners, Dr. Michael Sucher, who ran the physician health programs for the states of Arizona, Nevada, and California. So he's literally overseen the care of thousands of physicians over a 32-year career. So he brings to us a tremendous amount of experience on some of the issues that are so significant, dealing with physicians and nurses in particular, and where we quite frankly see the market going. And where we are today is technology gives us the ability to take what was an in-person experience and move it virtually on an outpatient basis so that physicians and nurses can get a high level of clinical treatment without having to leave to go to residential treatment, without having them commute to and from an outpatient basis. So it is significantly easier to participate in the program. There's a higher level of confidentiality because you're doing it virtually versus in person. So we think more people would be open to asking for help. And because the ease of participating in program, more people will actually be able to finish this program. So we think that we'll be able to drive higher success rates using our virtual platform. And secondly, we think is really unique is that some of the biggest challenges that the medical community faces today, they're really, what's really sad today, and you're seeing it today with higher suicide rates in the medical community, is medical professionals suffer in silence because of the stigma around mental health,
yes,
as well as the fear from colleagues of repercussions if they were, quote unquote, found out. So it's a big issue. The entire medical community is trying to figure out solutions to address these issues. It's a slow process in breaking down the barriers to entry to getting help. But we do believe that coaching and physician coaching can be used successfully to address some of these issues. So we're really excited.
Right. And what is the ideal clientele for your services? Meaning, at what level of substance abuse or mental disorder do you treat ideally in your world? Because if there's one extreme and then there's the other extreme, are you kind of in the middle?
Well, every person that comes to us goes through an assessment.
Okay.
So we need to determine whether this is an appropriate level of care.
Okay.
There may be some individuals that need a higher level of care,
Right.
either need detox, spend some time in residential treatment. But what's fascinating about over the 32-year career, and Dr. Sucher overseeing thousands of physicians during that period of time, he would say about 1/3 of the doctors that he has seen over his career would do better on an outpatient basis. It's less disruptive and a more appropriate form of care. But this kind of virtual birth, outpatient treatment programs didn't exist that were exclusive to medical professionals. So telehealth and the new virtual world allows us to create programming on a virtual basis, very specific to this demographic of patient.
Right. And which states do you provide the coaching and the clinical medicine to the providers?
So our first program, we're in New York, we're basically the tri-state area where
Okay.
we're providing clinically based, evidence-based treatment and physician coaching in one program, working with physicians, dentists, and nurses that are dealing with a drug or alcohol problem as their primary reason to come see us. There may be co-occurring mental health issues. There may be issues around burnout and exhaustion that are ancillary. But right now we are a drug and alcohol virtual treatment provider. So the type of patient that we work with initially are those that are struggling with these issues. We do offer a coaching program that's not subject to state jurisdictional issues, where our coaches are physicians and nurses, and provide a level of peer support. Because the evidence and the studies that are out there today are showing that physicians in particular are much more comfortable talking to another physician around mental health. So how unique is it to have our coaches, physicians and nurses, some of who are in recovery from drug and alcohol abuse themselves, as a softer, less stigmatized solution to begin the process of asking for help?
Right. At what point are you mandated to share any information to governmental bodies or medical boards, or does that even exist right now?
Well, it's so interesting. So then if your listener walks away with only one thing from this call, we are not mandated to report a physician or licensed medical professional who is voluntarily seeking out treatment to their employer or to a state medical board. In addition, because many states are mandatory report states for physicians, in addition, any physician or nurse that's in our program as a patient is not mandated to report another patient that's voluntarily seeking out treatment. So there's a sense of
That's
safety
awesome.
there. Yeah.
Oh gosh, and I'm glad you brought that up because that's would be on my mind if I were reaching out to you for help. What is the cost
Well,
for the treatment?
sure. We're an out-of-network provider, which
Okay.
is really important for us. We want to be able, people that want to have out-of-network behavioral health benefits can use their health insurance to pay for coverage. There are going to be people out there that just don't feel comfortable with that. Our coaching program is not something that is insurance reimbursable today. But we think over time, I think insurance companies will start seeing the benefits of integrating clinical treatment with coaching in one program and really would start supporting it because we're having higher success rates. So we're an out-of-network provider. There could be substantial reimbursement for costs, making it affordable, which was critical.
Right. Well, thank you so much for having this quick interview. I hope that if you know, if you're a healthcare executive or you're a physician who has a peer or somebody who needs help, offer this as a solution. Maybe make sure when you have your yearly announcements to your team, your employees, that they know that something else exists, even if they don't appear to need it. It'll be awesome to have this on your bulletin board, to have more resources. I think we need to share what resources are out there as we become a closer community with all this virtual telemed and confidential ways of communication. I think this is a brilliant way offering for our providers who are working so hard during this very stressful time. Thank you so much for this interview. How can people reach out? What's the best way, Stephen?
Best way is to either email me or call me. I believe, Elsie, you're going to put both those.
Yes,
Uh,
here's a phone number. 646-259 3172. And what is your email?
It's Stephen
Mm-hmm.
at veritassolutions.com. One word. And the
Okay.
last point I'll make, Elsie, which is so important, this problem is so serious that the medical professional leaders that are on listening to us today, I can't do this alone. We as an organization can't do this alone. We need to bring together leaders in this community to collaborate and work together to try to make a difference.
Well, thank you so much. Also, I'm going to put the website veritassolutions.com. And if you thank you so much for this interview. What we do every Sunday is post information for physician leadership, and this is just something that caught my eye. It's a little bit different than any interview I've done. I just ran into Stephen, was just amazed at what he's doing. There are people in Canada like Dr. Paul Roy who's doing something similar there, and I believe you're trying to work together with him to bring together a North American platform that would include Canada. If you're a physician leader or if you're an executive who has something to share for our physician community, I would love to hear from you. So please email me at info@drlcco.com, and please check out our website at leadphysician.org. Give me a thumbs up or a like if you'd like to hear more of these interviews in the future on Sundays. Thank you, everyone. Have a great Sunday.